I wonder if the senator from Idaho is hearing from seniors in your state about the proposed $465 billion in cuts to Medicare and how they feel about taking that money and spending it to create a new program.
I thank the senator from Tennessee for that question. Thank you, Mr. President. And very definitely we're hearing from our seniors in Idaho who see through this. It is very clear to the folks in Idaho that what we are seeing is a proposed massive growth of the federal government by over $2.5 trillion when fully implemented. That's to be funded on the backs of the American taxpayers and our senior citizens through cuts in Medicare. And in fact, in addition to those who have contacted me who are seeing their health benefits lost, I've also been contacted by a number of the providers. We're talking about those who are in home health care or hospice health care, skilled nursing facilities or hospitals and the like. And they make a very interesting point. Their point is that not only will senior citizens in Medicare Advantage in particular literally be losing their benefits dramatically, but that other senior citizens who are in traditional Medicare will also be losing access and quality of care. And how is that the case? Well, we know from the details of this bill that we are going to see major cuts in hospice care, home health care, skilled nursing facilities, and hospitals. And the points that are made to me by those providers are that they have already gone through a series of very deep cuts. Cuts to the point that in Idaho, I believe the number was for home health care, we lost something like 30% of our facilities already. And the way one of them explained it to me was that if you reduce the compensation that we are receiving, then we have to reduce something in our budget. And he said, we can't just start taking bricks off of our buildings. What we'll end up having to do is to reduce our personnel. That would be the nurses and the doctors and the other care providers who are there to provide support for these individuals. We'll have to reduce the number of rooms that we operate or the facilities that we provide. And in the end, there will be a reduction of services and access available to senior citizens, including a reduction in the quality of the care that they are able to be provided.
I wonder, in discussing the Medicare cuts, another provision of the bill, which we'll be talking about this month and next month as we go through the health care debate, is what about the problem of paying doctors and hospitals who see Medicare patients? Today, doctors who see Medicare patients get paid at about 83%, I believe, of the rate they would be paid if they were seeing a private care patient. And so every year, Congress comes along and has to make an adjustment in something we did a few years ago, which automatically cut the amount of money that we pay doctors who are seeing Medicare patients. That's a big problem for Medicare patients because if the doctors can't be paid, they won't see the patients. And the Medicare patients may find themselves increasingly in the condition that Medicaid patients do, low-income Americans who operate through the state program. That's our largest government-run program, where they're paid about 63% of what doctors who see private patients are paid, and about half Medicaid doctors won't see new patients. So I would ask the senator from Idaho, does he see anywhere in this bill a provision for the $500 billion that will be needed just to pay doctors about the same 10 years from now that they're making today? And if it's not in the bill, where's that $500 billion going to come from? Is it going to come from Medicare cuts, or will it come from adding to the deficits?
Well, obviously, it's going to come from cuts in Medicare or increased taxes or simply more debt on the federal level. And I think the senator raises a very interesting point. This question of fixing the compensation rates for physicians in Medicare is a huge question, one which we have been fighting for a number of years to try to find a solution to, as each year we delay the expected cuts that are going to happen. I've talked about this factor in the context of being a budget gimmick in this bill. And what do I mean by that? Well, those who say that this bill reduces the deficit are able to say so only because It has about $500 billion of new taxes, about $500 billion of Medicare cuts, and a number of budget gimmicks that delay the implementation of the spending sides of the bill, or in this case, don't even include at all one of the major expenses that needs to be accommodated, and that is the fix for physician compensation. If any of those things were not in this bill would drive up the deficit tremendously. And what we're going to see, in addition to these fiscal impacts on the federal treasury, in terms of huge increase in debt or huge increases in more taxes, even more than we are talking about in this bill, we are going to see the very real potential that access to medical care for our seniors will be again reduced because of this factor. Let me just give a couple of statistics. In their June 2008 report, the Medicare Payment Advisory Commission, or MedPAC, said that 29% of Medicare beneficiaries who were surveyed were looking for a primary care physician and had trouble finding one to treat them. In other words, about 30% of our Medicare beneficiaries today are having trouble finding a physician who will take a Medicare patient. That's before the $465 billion of cuts and before simply not including the physicians at all in this legislation. A 2008 survey by the Texas Medical Association found that only 58% of the state's doctors took new Medicare patients, and only 38% of the primary care doctors accepted new patients. Again, an example from MedPAC and an example from one state indicating what we know is happening around the country, namely that doctors are no longer taking, in increasing numbers, are no longer taking new Medicare patients, just as they have been doing with Medicaid patients for years. And yet we see these massive cuts to Medicare being proposed that will have the same impact on hospice care and home health service and skilled nursing facilities and hospitals. And we see the doctors not even included at all, meaning that they are projected now to receive major reductions. I think it's over 20% reductions in their compensation for taking Medicare patients. And the solution here to establishing a massive new federal entitlement program is not to cut Medicare. And I want to repeat something that both the senator from Arizona and the senator from Tennessee have already said that is very critical here. Reducing the Medicare budget by $464 billion is something, by any number, is something that has been encouraged in terms of trimming the growth path for Medicare. And that's something that this Congress has looked at in the past. But never was it intended by those who have made these projections about needing to control the spiraling costs of Medicare. Never was it intended that we address the fiscal circumstances in Medicare with the intended purpose of creating another new massive federal entitlement program that will grow the federal government by over $2 trillion. And we talked about the numbers. The full 10-year period is $2.5 trillion. And leave Medicare with these dramatic cuts, this loss of service and loss of benefits to the recipients, while they see this new government growth with a new government program. That was not in the minds of anybody who was asking us to deal with the solvency issues on Medicare. And it was, I don't think, in the mind of anybody who asked that we have some kind of health care reform to deal with the rising cost of premiums.
Mr. President, how much time is remaining on the Republican side?
You have 8.5 minutes.
Would you let me know when 4 minutes is remaining, and then the senator from Idaho will conclude our remarks at that time. Mr. President, the senator from Idaho has made a very important point in anticipating that our Democratic friends will have the next 30 minutes and some other things they may be saying the rest of the days. There was a lot of talk yesterday about a Congressional Budget Office report about the effect of this $2.5 trillion bill on premiums. And rather than take my word for it, let's go to the news section today of the Wall Street Journal, which has a headline, "Some Health Premiums to Rise." That means going up, Mr. President. That means the cost of your insurance is going up for some Americans. So my question is, why would we spend $2.5 trillion over 10 years, cut Medicare, raise taxes, and run up the debt to raise some health premiums? I thought the whole exercise was to lower the cost of health care premiums. The article says the analysis released Monday by the Nonpartisan Congressional Budget Office and the Joint Committee on Taxation. Now, we're supposed to pay some attention to these as nonpartisan outfits. Painted a complicated and uncertain picture. It said people who pay for their own insurance would see a higher bill, albeit for more generous benefits. That's the government-approved insurance you're going to have to buy. Unless they're lower earners who qualify for the new government tax credit, well, where's the money going to come from for those subsidies? It's going to come from grandma. It's going to come from Medicare. It's going to come from taxes. And it's going to come from increasing the debt. Now, those are facts, Mr. President. Employees of small firms, says the Wall Street Journal, would effectively see their insurance premiums unchanged. So for small firms, we're going to spend $2.5 trillion over 10 years, cut Medicare, cut taxes, and run up premiums for millions of Americans, so your insurance will continue to go up at about the rate it already was. Why should we be doing that? While workers at large firms would see something between unchanged and slightly lower premiums under the bill compared to what would already happen according to the analysis. Mr. President, we need to change the debate. We need to start over. Instead of this comprehensive 2,000-page bill that's full of taxes, mandates, and has as its general effect raising premiums and taxes and cutting Medicare, we should set a clear goal, reducing cost, and begin to go step by step toward that goal. Reducing junk lawsuits against doctors, allowing health care to be purchased across state lines to increase competition, allow small businesses to combine in health plans so that they can offer more insurance to employees at a lower cost. These three bills I just mentioned have been offered and rejected so far by the Democratic majority. More flexibility in health savings accounts, efforts at waste, fraud, and abuse, which are in fact Medicaid, the largest government-run program, and Medicare, the second largest, and more aggressive steps to encourage wellness and prevention. Now, one approach, the comprehensive 2,000-page bill, Washington takeover approach, Americans are very leery of. In my respectful opinion, this bill is historic in its arrogance for thinking that we could take a system that affects almost all 300 million Americans, 16% of the economy, and change it all at once. Why don't instead we go step by step to re-earn the trust of the American people? Republicans will be making those proposals on the floor this month and next month and as long as it takes to try to see that we get real health care reform. Cutting Medicare by $465 billion, cutting grandma's Medicare and spending it on a new program at a time when Medicare is going broke is not real health care reform.
Mr. President, how much time remains?
We have 4.5 minutes remaining, Senator.
Thank you, Mr. President. I'd like to conclude with our time this morning by focusing on the larger picture a little bit, as my colleague from Tennessee has just done in his concluding remarks. When you ask Americans whether they want health care reform, the vast majority would say yes. When you ask them what they mean by that, the vast majority in the polls and in my personal experience are saying, we want to see the spiraling costs of health care and our health insurance brought under control and reduced, and we want to see increased access to quality health care for those who don't have access today and for those who have limited access today. This bill fails on those two central points. What this legislation does instead is increase the size of government by $2.5 trillion of new federal spending, establish massive new federal controls over the economy, and even creates a federal government insurance company. It increases taxes by about $500 billion, and not just on the so-called wealthy. The vast majority of these taxes are going to squarely hit those who President Obama said would not be hit, those who make less than $200,000 a year, and frankly, all the way down the income chain. It cuts Medicare by $464 billion. It puts a major new unfunded mandate on our states who are already struggling in their fiscal budgets. And as my colleague indicated, it causes the price of insurance premiums to go up for the individual market, to go up in the small group insurance market, and to be basically unchanged in the large insurance market, according to the CBO study. And by the way, one of the things that is not pointed out in that CBO study very much is that in that large market, which it says will be the only part of the market that doesn't see insurance rates go up, one of the reasons is because their health care will go down. In other words, there is a tax on these larger high-cost insurance premiums that is going to be either passed through and cause their insurance to go up, or will be avoided by reducing the cost of their insurance and reducing the coverage of the benefits in these policies. So one way or the other, all Americans are going to see their health care premiums go up, or see a portion of them in the large groups see their health care premiums be held the same by reducing the quality of the insurance that they have. Now, if you go back to those two reasons that Americans wanted health care reform, did we see premiums go down? No. Did we see increased quality or increased access to care? Well, there are some who are going to get a subsidy in this program for this new massive federal program, but at what price? $2.5 trillion and $464 billion of cuts in Medicare. The establishment of a major new government program that would essentially be funded on the backs of massive new tax cuts, massive new tax increases, massive federal tax increases, and Medicare cuts. And in the end, we will still be in a system in which we are seeing spiraling increases in health care costs. To me, that's not the kind of reform we need. And my colleague from Tennessee indicated there are a number of reforms on which we can find common ground that will reduce health care costs. There are a number of reforms on which we can find common ground that will help us to increase access to quality care. And that's where our focus should be. And that's why I stand here today in support of my colleague John McCain's amendment, which is a motion to recommit this legislation to the Finance Committee. As was indicated, it could be done in one day, to simply remove the Medicare cuts that are contained within it. Let's just fix that part of this bill, and then let's work forward. I see, Mr. President, that my time has expired. I encourage this Senate to focus closely on this legislation and to let us work together in a bipartisan fashion rather than speeding ahead and trying to pass legislation that has not had the opportunity for this kind of bipartisan effort to develop a good work product for the American people.